Completed his Masters in Prosthodontics from the same university in 2004. He is a well-known practitioner and academician in Chennai with 19 years of experience in implantology. He has spoken in various national and
His emphasis is to reverse engineer the whole process, understand what is the digital workflow that we have, what we can do.
Whichever arch that we have placed that implant, we first scan that particular arch and we start the scan with the healing abutment in place. So we do the implant arch scan with the healing abutment in place. The purpose of gingival mask scan is to have the ideal emergence that is required for us to give.
Would be for us to understand the digital workflow of restoring implants and how the quadrant of success improves predictability and aesthetics. So when I say the quadrant of success, we looked at all the four quadrants that are there. The 3D positioning of the implant, the prosthesis type, whether it's going to be a screw retained prosthesis or a cemented prosthesis. Are we going to customize a time base either with zirconia or customizing the time base with Emax? So once we have understood that, how are we going to have a superstructure on top of the time base? Or what is the material of the superstructure? Is it going to be zirconia? So place an implant, immediately restore with a provisional abutment and a provisional crown on the patient on the same day as implant surgery. So now, so the importance of provisionalizing to the final aesthetic outcome is what is seen here. So here.
Do you like the video? Press the like button. Do subscribe and click on the bell icon to receive such videos. Thank you.